About 8 years ago, started talking to some people about developing a hand fellowship. We had 4 hand attendings, and we're bringing in a large amount of regional volume. So the fellowship was started with 2 AOA. It's now ACGME approved for 1. Going through the transition, we need 2, and that's our plan moving forward, is to get a second one. But they're grabbing 600 to 800 cases a year. They have a great camaraderie. They learn to teach chief residents, and chief residents teach some of the fellows because they come from different backgrounds and different experiences. So it seems to work out pretty well. The educational program for hand is set every single day, and the anatomy lab has our older microscope in there to practice on micro cases. We get specimens bi-weekly or monthly that they can work on approaches on cases that they're going to do, and they're fresh frozen, so it works out well. We feel that getting the specimens are the best answer. We have an orthopedic clinic that's set inside Cassano Clinic, so there are a large number of referrals that come out of our emergency rooms or family practitioners throughout Kettering Health Network that may not have insurances that other people take, or may not have insurance. And we have the residents work with that population. And we also have a hand clinic that occurs. It's exactly the same, where we review every single case that the fellow sees weekly. So there are 15 to 20 cases are reviewed every week in a 20, 30-minute session, just bringing up ideas. It's sort of like the way our group works. When we have 20 people in our group, we have 6 hand surgeons, but I know I got help from anybody if I need it, so you can count on someone and they can count on you.
What was it that initially attracted you to the program here?
I think one of the things that I was interested in with fellowship is I wanted to work with people that I felt like I could develop relationships with, that I could sort of lean on throughout my career to guide me and to just be there. And so when I first interacted with the group at Dayton, I just felt this sense of camaraderie and just like real passion for hand surgery and education. I think that was the biggest thing, is the relationships and just the quality of individuals.
Yeah, I totally agree. Just in my first couple months here, being able to see how well the hand partners get along together, and for a group of private practice guys to be as committed to education as they are is pretty awesome to see. As you were kind of working your way through the year, what would you describe the level of autonomy in the OR and in the clinic like?
Yeah, I mean, I think that's one of the strong suits of the program. Starting with the OR, I mean, it's phenomenal. You have kind of a varying range depending on the faculty, but you get quite a bit of autonomy, and you start as an orthopedic surgeon or whatever you come from, and so they kind of give you that respect because you've completed your residency and you don't have to be there, and so they do give you that autonomy to grow and to learn. But then there was also some faculty that would be more right alongside you and teaching you, and then giving that sort of that graduate autonomy. But I think the level of autonomy that I had at Dayton, and Nate, the other fellow my year, really prepared us well for going into practice. And I would have to say that being in the OR is the place that I felt the most comfortable being in practice now, and I owe that a lot to that autonomy that we had in Dayton. I think the clinic, the autonomy is good. It's pretty standard when you're with the attendings of seeing patients and formulating a plan, and they respect your opinion, which is good. But I think that the biggest highlight from a clinic perspective in Dayton is your fellow clinic. You get the reps of going through a clinic day by yourself, having to kind of manage the staff and sort of your process for meeting a patient for the first time, working them up, treating them, whether it's surgically or non-surgically. And then getting to see patients post-operatively. I know we probably all had some of that experience at residency, but when they're coming just to see you and you don't necessarily have an attending over your shoulder to lean on, I just felt like that was invaluable. And just seeing walking people through that post-operative course for an entire year was incredible. And I there's always more to learn when it comes to clinic stuff and OR, but I felt like it really prepped me for the real deal.
And how about the question that I'm sure many people are wondering about? What about call?
Yeah, so calls is not too onerous in Dayton. It's nice because there is a residency program there that takes the brunt of it, and essentially you act as a backup to them, and then depending on what attending you're on service with, you sort of are the backup in case something needs to go to the OR.
There are all kinds of applicants looking for all kinds of different things in the program. What kind of applicant do you think will succeed here, and that this would be a good program for them to learn?
You know, it's a community program, and so it's. I think if you're looking to be a community hand surgeon, this is a great opportunity because it's you know, high volume. There's a lot of work to be done. It's also, if you're interested in going into private practice at some point, this is a very efficient, very well-run private group. And so not only do you learn the efficiencies of doing surgery and running a practice, but you also learn just the business side of medicine. And so I think if those are of any interest to you, this is a great program for you.
Certainly, yeah, I totally agree. I think with regard to the ever increasing popularity of hand fellowships, trying to include shoulder in their programs, that's represented here. I think that you can tailor your year, it seems, to have as much or as little shoulder as you want. They really try to do their best to give you a good education and also have some flexibility to let you tailor it to your personal interests. So without taking any more of your time, I appreciate it, Dan. Thanks so much. And for everybody that watches this, good luck with your upcoming applications and interviews.
Goes fast.